My name is Jon Sigfusson, and I'm the director of Planet Youth. This is our life work since more than 20 years ago. Started in Iceland, and it's all about preventing children from starting to use substances, any kinds of drugs. And this developed into Youth in Europe in 2006. And 3 years ago, this methodology caught world attention and is now being implemented in hundreds of municipalities all over the world. And we're very thankful for that, of course, and hope we can do our bit in changing the world a little bit for the better. If somebody told you that it was possible to prevent children from using drugs, from starting to use drugs, would you believe it? For the next 20 minutes or so, I will tell you about the methodology that has been used in Iceland for more than 25 years in this regard. And this now goes by the name Planet Youth and is being implemented internationally. Let me start by showing you a picture taken downtown Reykjavik in the summer of 1997. This was a very common sight. This is in the middle of the night in June. Don't be fooled by the daylight. This is how the nights are in the summer in Iceland. And the town was full of young people, and many of them were using substances. At this time, in 97, 98, Icelandic adolescents, they scored highest in Europe, or among the highest in the use of drugs, alcohol, tobacco, and cannabis. At this time, 46% had become drunk for the last 30 days. This is 15 and 16-year-old. 23% were daily smokers of tobacco, and 17% had tried cannabis. So the situation was very, very serious and was to be taken seriously. But in a period of around 15 years, from 1998, this is alcohol drinking, getting drunk for the past 30 days. This went from 42% down to 5% in a period of 5 years. So it was a very steep downward development. 3 years ago, in January 2017, this title was published in newspapers all over the world. This is not written by us, but by a journalist. Iceland knows how to stop teenage substance use, but the world is not listening. This went viral all over the world, published in languages that we will never understand. And after this worldwide media attention, the world has actually been listening, and we have been traveling the world and introducing the model in all the continents. I'd just like to mention before I continue that when I say we, it's we is all the people working on prevention in Iceland. So this is the trend. This is 15 and 16-year-old from 98 to 2020, 42% being drunk for the past 30 days, down to 7, 23% daily smokers, down to 1%, and 17% were using cannabis once in their lives or more in 98, and now this is down to 6%. So this is a huge and steep downward trend, which we are very proud of course. As I said, the international development has also been very rapid, and we are very proud and honored 2 years ago when Odessa started adopting Planet Youth, the first city in Ukraine. I visited Odessa at the time. It was very pleasant. Thank you for that invitation. But now we have partnered with hundreds of municipalities all over the world, in all the continents except except Antarctica, where they only have penguins anyway. So this is basically what we're doing now, introducing the model all over. Now, what's the success behind it? There are three main building blocks. The first one is evidence. We always need to use evidence before making a decision in the lives of our children. We cannot use our feelings or what we think or what somebody says. We always have to have empirical scientific evidence before making a decision in something that touches the life of our children. The second pillar is the community-based approach. Planet Youth never addresses a whole country at once. It always needs to be municipality by municipality, city by city, town by town, because where you live right now, where you work, that is where you can actually have some influence. You cannot have influence as a prevention worker in a city 500 kilometers away. You just have to focus on your close reality. And the third thing is that we need to open up the doors between science, research, policy, and practice. People working in the different fields, policymakers, practitioners, researchers, they have to work together. Much too often, where we come, we see that these three categories of people don't know what the other one is doing. And this is something that needs to be changed if we want to see some success in lowering substance use amongst children. Now, we are often asked why we put such emphasis on research. Everywhere you want to succeed in medicine, engineering, tourism, fisheries, pharmaceutical industries, wherever you are working, you always use research. In the pharmaceutical business, you would never put a new pill on the market without testing it first for a long period of time to make sure that everything is as it's supposed to be. So why shouldn't we use research just as well when it comes to the most important thing in our lives, our children? Some people think that we don't need to use research when it comes to children, but that is absolutely wrong. We need research before making decisions there. Now in Iceland, we have been collecting data, and I say we, all the people working on prevention, since 1992 until today. So this is 28 years of consecutive data collection. We collect data amongst different age groups. And the questionnaires that we are implementing amongst the children in these age groups, they don't only ask about how much children drink and smoke. They ask about everything of importance in the lives and the environment of children. They ask about their friends, their family, values, mental health, physical health, leisure time activities. And we need this information in order to be able to find out the environment and what needs to be changed in the environment. I'll come later to what we call the risk and protective factors that we find in the local communities based on this information. There are certain factors that are leading towards the initiation of using drugs, and there are also factors that lead away from it. Now, this is also very important. Every time we do a data collection, we deliberately divide it into two parts, scientific and practical. The scientific part, we have published more than 100, I've lost count, papers in journals, international journals all over the world, peer-reviewed. So science always forms the platform for practice. This is, however, where many scientists stop. They publish papers and they finish their last paper and and then they start the next paper, which is of course good. This is really important. But we take this one step further. The practical part is that within just a few weeks after each data collection, we make sure that the people working in prevention on the local level, in the schools, in the districts of the cities, in the different municipalities, they get practical information immediately about the situation and also about the risk and protective factors. So if there is something wrong or something that people want to address, you can do it on a local level. You can never look at the whole country at the same time. That's just out of reach for anyone. And these reports, they include a lot of descriptive facts. There is not much text. It's for everyone to understand. It's about the situation and the risk factors and the protective factors. Sometimes everything is looking fine in the schools or the districts or in the areas. Sometimes 2 or 3 factors are standing out, and because you see these factors on the local level, you can address them. If you don't see what is wrong or what needs to be done, you probably won't do anything. Or sometimes, like some people do, on a national basis, they address a whole nation with an issue when maybe only 10% of the nation needs to be addressed. So that's kind of throwing efforts and money out of the window. So immediate feedback about the situation on the local level is hugely important, and don't hide it. The data is collected in the schools. However, it's not the school's fault if something is wrong. The schools are only where we can reach the children. In Iceland, we're working with municipalities with over 90% of the population. So, and this has been growing and actually been like this almost for the last 20 years. So each and every region of the country has its own findings and can work from that. Now, in 98, if you come with me back to 98, we learned several things. There was a constant upward trend. We had data from 92, a little bit from 89, and we could see that substance use was on the rise really rapidly. But at this point of time, we could already see from the data that we had that there were certain circumstances and behavior in the lives of children and adolescents strongly connected with substance use. Things in their environment that we could see were strongly connected. And we saw 4 main domains of intervention that needed to be addressed. The family, for example, children who reported that they spent a lot of time with their parents in a normal family, they were less likely to start using drugs. Children who reported that it was easy to get caring and warmth in the family, less likely to start using drugs. Children who reported that their parents knew where the children were at night and with whom, and knew their friends, less likely. So this we could teach the parents how they could be the biggest preventive factor in the lives of children. If we look at the red dot, just one example there, we could see, for example, a risk factor, the peer group effect. If you were hanging out late at night with friends, coming home maybe after midnight, that was a huge risk factor. Children who were hanging out late or even hanging out in the middle of the day, doing nothing, they were more likely to report that they had started to use drugs. We see the individual is always there in the middle. Now, the school is hugely important. The school does not only teach children, about important things, but the school is, if children feel well in school, then they're far less likely to start using drugs. It's a hugely important institution. Now, if we look at the green dot, it was hugely important what we saw, that children who reported that they were active in organized extracurricular activities like sports, they were, what we saw to begin with, less likely to start using drugs. However, when we started working in other countries, we could also see that even though children were participating 3, 4, 5 times per week in an organized activity, this could be a risk factor. So we started asking ourselves, why is that? And found out that if the activity, whatever it is, it can be playing music, it can be some other form of art, it can be football or basketball or anything. If the quality of the activity that was not good, then this could be a huge risk factor for the children. So we need to make sure that the quality of the organized activities is good. So a totally different methodology was set in place in Iceland. What we had been doing before was not working. What we had been doing was teaching children about the negative sides of substance use. We don't really need to do that. Children know that drugs are dangerous. And making a school program is very easy. Tell children how to behave, but that is not what we need to do. We need to change the environment of children so that they are at lesser risk of using drugs. So this was scrapped. And Drug-Free Iceland was started in '98, as I say, to change the lifestyle environment of children, to change their actual behavior. And this has had a serious effect, because we see that the substance use in the primary schools, secondary schools is going down. This is from the high schools. In the year 2000, 64% of high school students had become drunk for the last 30 days. Now this is around 32%. And high school students who had never become drunk in the year 2000 were 18%. Now this is 46%. So 46% of high school students have never become drunk. So the substance use follows cohorts. If you can prevent children from starting to use substances, this will follow them at least throughout their schooling. And of course, we know that underage drinking is a leading public health problem. Children who report having started to drink or try to drink before the age of 15 are 4 times more likely to become alcoholics later in life. Now, the findings were used in a simple way. We knew this was important. And what has been done, and if I would quit here, we have tried to strengthen the preventive factors that we see in the societies and weaken or eliminate the risk factors. To the last point of my presentation, the close community. Prevention workers in Odessa, they need Odessa findings. They need Odessa data. They have no need for data from Kiev or vice versa. You always have to work on the local level. Strengthen the preventive factors and weaken or eliminate the risk factors. That's what has been done. And at the same time, we see that this is happening, and we have never been talking about drugs. We have not been focusing on teaching children about drugs, but we are changing the environment so that children are at lesser risk of starting to use drugs. That's our primary prevention. Thank you very much.